What if I told you a billion people are fighting a battle nobody sees? This is Kenya News Update today. Coming up, you'll discover the hidden epidemic of shame and isolation affecting millions across Africa, and the shocking truth about why mental health is the missing weapon in this fight. Meet Amina, a mother of three from a village in Kenya. For years, she lived with a painful, disfiguring skin disease, but the physical pain was nothing compared to the isolation. Her neighbors whispered. Her children were teased. She was told she was cursed. This is the unseen suffering of neglected tropical diseases, or NTDs. And today, on World NTD Day, the World Health Organization is sounding a global alarm. But here's the twist. The fight isn't just against the disease anymore. It's against the stigma that comes with it. The WHO warns that millions face profound suffering due to discrimination and untreated mental health conditions. Under the theme Unite, Act, Eliminate. They're urging a seismic shift. But here's what nobody's talking about. People with these diseases experience higher rates of depression, anxiety, and suicidal behaviors than the general population. And yet, most never get the mental health support they desperately need. Dr. Tedros Adhanom Ghebreyesus, the WHO Director General, puts it bluntly. He says, the fight against neglected tropical diseases is not only a fight against pathogens, it's a fight against the profound human suffering they cause. True elimination means freeing people not only from the disease, but from the shame, isolation, and despair that too often accompany it. And then, something shocking happened. The WHO just launched its first ever global guide to tackle this exact crisis. It's called the Essential Care Package. This guide is a blueprint for health leaders. It shows how to promote good mental health, identify conditions, provide treatment, and smash stigma at every level from the individual to the entire health system. Diseases like cutaneous leishmaniasis, leprosy, and lymphatic filariasis don't just scar the body. They scar the soul. Misconceptions about contagion run deep, pushing people into shadows. But here's the part that will blow your mind. We are actually winning the fight against the diseases themselves. The number of people needing NTD interventions has fallen to a historic low of 1.4 billion. That's progress. Significant declines in death and suffering. But this historic gain is now at risk. Why? Because funding is declining. And if we don't fund the fight against the stigma and mental health crisis, all that progress could unravel. The implications are massive. This isn't just a health story. It's a human rights story. Some say the focus should be on medicine alone. Others say you cannot heal a body without healing a mind. The controversy is real. But the unanswered question remains, if we have the tools to treat the disease and now the guide to treat the stigma, why are we leaving a billion people behind in pain and isolation? This is about more than viruses and parasites. It's about dignity. Do you think integrating mental health care is the key to finally eliminating these diseases? Or is it a distraction from the core medical mission? Drop your take in the comments. Subscribe to Kenya News Update today for more stories that challenge how you see the world.